This presentation will focus on pregnant women, and in particular, a 29-year-old pregnant woman named Ellie. We will be exploring the social determinants of health, being social environment and health services and resources. It will look at the risk factors present in her life and will then go on to discuss contemporary health issues which are influenced by risk factors. Finally, it will provide strategies that a primary healthcare nurse can use for pregnant women to provide better health outcomes. This case study follows Ellie, a 26-year-old female from Wollongong. Ellie is currently 28 weeks pregnant. This is Ellie's first child, and she will be raising this child alone, as the child's father is no longer involved in Ellie's life. Ellie has a history of polycystic ovarian syndrome, hyperglycemia, anxiety, and depression. Ellie's mother also has diabetes type 2. She works as a receptionist at an office and spends most of her days working at a desk. Her level of physical activity would be considered sedentary. Ellie has been feeling anxious about giving birth and being a single parent. According to the World Health Organization, the social determinants of health are described as the circumstances in which people grow, live, work, and age, and the systems put in place to deal with illnesses. The conditions in which people live and die are, in turn, shaped by political, social, and economic forces. These factors impact or determine health outcomes for individuals. When looking at our first social determinant of health, being the social environment, it is important to understand the impact of having a social network surrounding you during pregnancy. Having a positive social environment positively influences mental health and provides support. Without support, a pregnant woman might feel lonely and develop perinatal depression. As Ellie has a history of anxiety and depression, it would be important for her to have a strong support network. Being a single parent, it is important for Ellie to have a support person throughout her pregnancy, whether that's a family member or a close friend. Having a support person may make her feel less alone, and having support may reduce risk of perinatal depression. Having access to health services and resources is detrimental to a healthy lifestyle. For first-time mother Ellie, having access to health services and resources such as antenatal parenting class may alleviate any stresses or anxieties surrounding birth. It provides parents with education about birth, as well as preparing parents with potential challenges they may face. New South Wales Health states that knowledge reduces fear and promotes confidence. Ellie will be supported by a team of multidisciplinary professionals to help her guide through her pregnancy and beyond, as postnatal classes are also available and highly encouraged for first-time parents. Other healthcare professionals and resources available during pregnancy are public hospital care, GP care, private obstetrician and a private midwife care, private obstetrician and private GP, shared care, and midwife care. Some of Ellie's medical history may increase her risk of developing gestational diabetes. Her sedentary level of physical activity, her PCOS and hyperglycemia, her family history being her mother that has type 2 diabetes, as well as being above a healthy weight range, all contribute to developing gestational diabetes. If you've had gestational diabetes, you have a 1 in 2 chance of developing type 2 diabetes in the next 5 to 10 years. You are also at a higher risk of developing type 2 diabetes for the rest of your life. When the pregnancy is over and blood glucose levels usually return to normal, and gestational diabetes may disappear. However, gestational diabetes makes increased chance of developing insulin resistance, which increases the risk of developing type 2 diabetes later in life. Diabetes can actually cause chronic conditions such as blindness, limb amputation, and potential dialysis, according to the World Health Organization. So it is detrimental to prevent gestational diabetes. Given Ellie's history of depression and current feeling of anxiety, it would be important to consider her mental health, being that her history places her at risk of developing perinatal depression. So antenatal depression covers the period during pregnancy, postnatal covers the period after pregnancy, and 1 in 6 women actually experience postnatal depression. Perinatal depression, according to Beyond Blue, covers the period from conception until the baby is 12 months old. Ellie is at high risk of developing perinatal depression due to the lack of social support around her, as well as her current anxieties surrounding birth and her medical history. Just to name a few, some common symptoms may include a low mood or feeling numb, feeling inadequate, feeling angry, or fear for the baby and fear of being alone with the baby. Primary healthcare nursing strategies we may consider when providing quality care for Ellie include mental health education, antenatal classes, routine checkups, vaccinations for once the baby is born, gestational diabetes education, including management and prevention, as well as educating on what type 2 diabetes could cause later in life, and also referring to appropriate multidisciplinary healthcare professionals, including nutritionists, potentially for the diabetes, psychologist for her mental health and anxiety and depression, and a midwife to follow her through her pregnancy journey.